Hi, everybody. I'm Brandon Coe with the Rheumatology APP program and organization, and I'm the pediatric chair for RhAPP and one on the board of directors. And I'm here to talk about the origin story for two pediatric rheumatology APPs and our journeys kind of through RhAPP. And I'm here with...
Hi, I'm Brandi Goble. I'm a pediatric rheumatology nurse practitioner out of New Orleans, Louisiana.
And we just wanted to share our stories about how we both got into pediatric rheumatology and doing pediatric rheumatology in particularly like rural and underserved locations where there's not a ton of access to care, and how our experience with RhAPP has kind of helped shape that and given us some resources to bring to bear at our particular practice settings. So I'll start since I'm like the old fart here. And I've been doing rheumatology for 8 years now. I did primary care for about 7 years before that in at community health centers and then the Indian Health Services. But when I started with pediatric rheumatology, I didn't really realize that there was an APP role, and neither did my collaborating MD. He had just graduated from fellowship and had come out and knew he needed help out in we were in Albuquerque, New Mexico. We were the only pediatric rheumatology center there. And so he wanted to create this role at the clinic to help expand access. So brought me on, and he set it up with like, well, I'm going to make this a fellowship for you. I'm going to teach you basically everything I know, and and you're just going to learn it all with me. And I said, great. So that's kind of what we did. And over the course of basically 2 years of just kind of being basically being connected at the hip, I absorbed as much as I could. 5 years ago, after the pandemic, actually had my first RhAPP national conference, and realized that there was a community of APPs in rheumatology. I had never met any other APPs, and actually met other peds rheumatology nurse practitioners. There was a small group at that point, and in talking to people, realized we needed more pediatric specific content for RhAPP because we are a growing cohort of pediatric APPs in this space, and we have such access issues across the country, but especially in our rural and underserved areas, that we're going to be playing more and more of an active role. And so through that, we've been creating a pediatric content. It's been growing every single year here at the national conventions, and then digital content, kind of like this, to help increase awareness and access and education for our Peds APP colleagues. And then some of the most recent offerings was the Pediatric Step Up program, which is the Step Into Rheumatology and the Step Up to Rheumatology curriculum, which very proud to say that a lot of our Peds APP colleagues have contributed fantastic content to make sure that there is good pediatric representation for all of our colleagues across the country. And most recently, we have started the visiting lecturer program, where we actually are able to go to both our respective training institutions and other institutions for APPs across the country who are interested, and actually give rheumatology lectures to them to encourage both awareness from our colleagues about how to treat these conditions, and also encourage our APP colleagues to get into the rheumatology workspace, both in adults and pediatrics, because there is really such a need. And I'd be very curious, Brandi, to hear kind of what your experience has been as a newer APP in the field, especially in peds rheumatology, and especially in your unique practice setting.
Yeah, so I'm also in an underserved kind of area. I'm in New Orleans, Louisiana. So in the peds world, I started in March of this year, so I've been there about 6 months now, and I am a new APP. I graduated NP school in December of last year, so rheumatology and just being a provider in general is all a new experience for me. And so my collaborative physician, she's been the only peds rheumatology provider in the state of Louisiana for the last 2 years. And so there's definitely a need to provide more access to care to those patients. We have, we have patients that drive 4 hours for an appointment. So there's definitely a need. Definitely a need. And kind of similar to what you were saying, she has been the greatest mentor to me. We're pretty much attached at the hip as far as training wise and everything. And then she actually is who got me in touch with RhAPP and kind of getting started in the Step Up program, which was really beneficial for me to just lay a really good foundation of rheumatology and peds rheumatology. Those refreshers in immunology, and having a visual for everything was really helpful as well. Especially, I came from a HEMOC background, nursing background.
Nice. Okay.
Yeah, so some things sounded familiar, but didn't quite carry over exactly. And so having that information to refer back to and kind of lay the foundation for the rest of my learning in rheumatology was really helpful.
That's awesome. Yeah, I don't know what your training program was like, but I know for mine, like it was a fantastic program, but there's no rheumatology specific content there. And so you really are left kind of learning through experience, which is sometimes a difficult way to learn a complex field like rheumatology. And so that mentorship is super important to have with your collaborating providers. And then having kind of the resources available for RhAPP with our colleagues who are, here at the national conferences, and we can reach out to them through the network of the RhAPP ACE app and things like that, and our perhaps overactive email listserv as well. But there is about 40 of us now across the country for the peds rheumatology APPs, and kind of growing every day. And so it's been an exciting time for things. Yeah,
it's nice. It can feel isolating, being the only one at your institution, the only one in your area. So getting to come to RhAPP and meet all the other APPs, especially the pediatric ones, has been really great. And, getting to meet colleagues in neighboring states that we can share patients, or we get patients from them, they get patients from us. So just knowing that there's other people close by, and I can put a face to the name, and has been really nice.
Yeah. And people move around so much. There's really kind of a network of us that we can kind of help provide that continuity. Like I work with my Colorado colleagues a lot. I'm meeting some of my Texas colleagues for the first time here this year, who we've been kind of exchanging patients back and forth across Texas as they move and migrate and things like that. So it's a fantastic growing community. It's funny, you remind me of the first year at RhAPP at the conference. I actually met the adult rheumatology nurse practitioner that was at my institution that I didn't even know existed. And so we had been working in parallel together, but she didn't know I was there and I didn't know she was there until we actually met each other at the conference. I was like, it's such a small world, but such a kind of a distributed world for rheumatology because we're so few and far between things.
Yeah, definitely.
But happy to have you here. And, RhAPP is growing every day, and because of providers like you who are coming into the field, and it's fantastic.
It's good to be here. I love it so far. And then just having RhAPP and Step Up, it feels very supportive, and I'm not just out there by myself. So it's nice.
Nice. But what got you into rheumatology? What made you choose rheumatology after your program?
So my NP training was in primary care peds, and the nurse practitioner that I trained with, she was briefly the rheumatology NP before my now collaborative physician got there. The rheumatologist who worked there had retired shortly after she started, so her training experience wasn't the best, and so she eventually left rheumatology and went to primary care. But when I was training with her, some of the questions she would ask, some of the labs she would order, I was like, how did you know to order this? How do you know to look out for these things? I don't feel like I was trained in that.
How do I level up my game like this?
I'm there was some concern there. And she said, no, I know this from, my days in rheumatology. And so some of the patients she saw in the rheumatology clinic are now with her as their PCP. So I got to see some of those patients. I'm in their chart, seeing some of, just reading their history and everything. And it was really interesting. And that's kind of what led me into the rheumatology world and how I got connected with my now collaborative physician. And so,
that's awesome.
It worked out perfect.
That is awesome. So thank you so much for listening to this podcast about kind of how two pediatric rheumatology APPs got into the field. Next year, I hope you'll join us at the national conference for RhAPP, and keep an eye out for more digital content that's coming out about all things rheumatology and more things pediatric rheumatology to come.